8:13. It's Thanksgiving week, so Dr. Brent Wallis, Chief Medical Officer of People's Health, joins us today to talk about senior health. Good morning, Doc. How are you?
Hey, Tommy. I'm doing good. How about you?
I'm doing well, thank you. So many of us are caregivers, whether we realize it or not. 40 million Americans provide unpaid care to adults with disabilities. So I guess one can suspect that caregivers at some point in caring for their loved ones would reach a state of burnout. And if you've gone through it with an elderly parent, you know what I'm talking about. Well, today, Dr. B is going to talk about caregiver burnout and the resources that are available to help. First, some definitions. How do you define a caregiver, Doc?
Sure. So a caregiver, pretty simply, is just a person who tends to the needs of another person. And usually that's someone who's got some limitation, either short or long term, due to an illness, injury, or maybe even disability.
And what are some of the, I guess, typical caregiver roles?
Well, caregivers do all sorts of things. You know, in addition to providing care, they really act as a medical advocate for the person that they're helping. They can help manage prescription medications. They help with personal hygiene. They help with making and serving meals and making sure that the person gets the proper nutrition. But they can even help with housekeeping, home maintenance, taking them to doctor's visits, and then, you know, assisting them in getting around. And it's not just, you know, holding their hand when they stand up. Caregivers are usually trained to know how to properly get someone out of a chair and transport them around.
And I guess technique is very important when it comes to that.
Yeah, very much so that you don't cause any additional problems.
So as caregivers take on responsibilities, what are some of the issues they themselves may face?
Well, they do so much. You know, they have to think about themselves as well. You know, caregivers can develop some issues with their own mental health. There's a lot of anxiety and stress involved in taking care of others. So you have to make sure that you're paying attention to your own mental health. But then physical concerns are really important as well. You know, that stress can increase stress hormones, and stress hormones can actually increase your blood pressure. So you have to really make sure that if you've got medical problems that you're taking care of those also. You know, there can be other strains. Caregivers often are also working, trying to hold a job down, and so they have to make sure that they can do their own work while they're trying to help for someone else. And then some of the things that can become really difficult for caregivers is they sometimes have to assist in care decisions, you know, what you have to do around end-of-life situations, talking to the family of the person that they're taking care of can be quite difficult. Sometimes families can become factioned and have different opinions of what's going on. So you really have to be the advocate for the person that you're caring for, you know, who really has those limited resources.
You know, Doc, it happens in every family, and I'm sure you've seen it, where maybe there are one or two adult children that are the primary caregivers, and then somebody else comes in and lives out of town, and they tend to want to take over everything and ask a lot of questions. And I guess maybe it's better in that case just to kind of ease into the situation and understand that you don't know what you don't know.
Yeah, I think it's very common for that to happen. A family member who's not as close to the person that needs that much care sometimes comes in and feels like they know more of what's going on. And so it's really the responsibility of the caregiver in a lot of cases to try to prevent those conflicts from happening, because that can get pretty ugly.
Mm-hmm. What kind of help is there out there for people that are caregivers and maybe feeling burned out?
Yeah, fortunately, there are quite a few resources. You know, respite care is something that a lot of people are not aware of. But if you speak with your council on aging, they can actually explain what is available to you. And essentially, respite care is an opportunity for someone else to kind of step in and try to help take care of the person that you're trying to assist, to give you a little break. There's a lot of community resources available. There's some that are volunteer programs. There's some that are state-funded, and even Medicaid actually offers some programs that are paid for. You know, some other areas I tell people to look for are adult daycare programs. which is exactly what it sounds like. It's a place where you can take the individual during the day so that someone else can assist, and then you can go to work or take care of the needs that you have. And when things get more severe, you may even have to look into things like facility-based respite care, and that's things like nursing homes or another facility that can help. And then, I tell caregivers to make sure they don't feel bad about asking for help. Identify family members of the person you're helping who can actually rotate through and give you a little bit of a break. And then, fortunately, there are insurance plans. People's is one of them that actually offers a respite benefit, so they can help to pay for some of that respite care as well.
Let me take a break here, and then we'll pick it up when we come back. Some very important stuff with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. A lot of us reunite with our relatives, although this year maybe not such a good idea. And then you maybe see something going on in a family where you realize how much a cousin might be taking care of an uncle, and you didn't realize what they were up against, and maybe you want to pitch in and help in terms of caregiving. So when we come back, we're going to talk about guilt, because a lot of people get tired and then they feel guilty about getting tired. So we'll talk about that and some other tips to avoid and maybe minimizing burnout if you are a caregiver with Dr. B. 8:20, time for traffic now, WWL. Tommy Tucker, WWL, talking to Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health, about senior health today because, of course, the day is usually on Thursday is Thanksgiving, and we're talking about this week. We're talking about a very important subject, and that is caregivers. Somebody texted in, I was my parents' caregiver till the day they passed away. It can be stressful if you don't have information to help you, and that's what we're trying to do here. So, Dr. B, in terms of guilt and maybe tips to avoid or minimize burnout with caregiving, talk about that, if you will, please.
Yeah, you definitely have to take a break for yourself, and like you said, you shouldn't feel guilty about it. Taking a couple of hours to take a walk or exercise or even watch a movie is something very important to kind of keep you going in what you're doing to try to help somebody else. There's a lot of other things that you can do that can help. If you think about caring for someone who has a large family, you may spend half your day getting phone calls and text messages asking how their loved one is doing, and that can take a huge amount of your time. And so the AARP actually offers several different services online that allow you to securely post updates about that individual so that you can just direct people, to that area so that they can look and see what's going on. I think it's really important, too, to look at support groups. There are caregiver support groups that you can join where you can talk to other people that are going through the same situation you are and providing the same type of care. Alzheimer's Association in particular actually offers a lot of locators for support groups in the New Orleans area. That can help you develop really good, positive relationships with other caregivers. So it can help you kind of share your frustrations and your concerns so that you're taking care of yourself. And really what's most important is taking care of yourself. We joke, but, when we used to fly back before COVID, they always say right before you take off, put your oxygen mask on yourself before you assist anybody else. And the same concept is true in caregiving. You have to take care of yourself or you're not going to be able to take care of someone else. So you've got to make sure that you're taking care of your health, getting proper sleep, taking your medications, exercising, all of those things.
If the caregiver needs a caregiver, that's not a good thing.
No, you don't want to end up there, so that's why you have to really be aware of what your needs are as well.
So what are some of the resources that are available for people that are listening right now? Maybe they're caregivers, and you can share with us?
Yeah, sure. There's a whole bunch of stuff online. I mentioned AARP has a lot of great resources. They have a caregiving forum that can provide a lot of information, support groups, really good stuff that you can find there. You can also go to the Elder Care Locator. That's a tool that lets you connect with your local area councils on aging. And that can kind of guide you to a lot of the community resources that there are. We have some wonderful councils on aging here. The Jefferson Council, which we work real closely with, has an aging and disability resource center that can really help to match you up with what the community has to offer and what your needs are. And that can help you find services like personal care, even home care programs, the respite care that I mentioned. Some people look into medic alert services, which are the devices that help if you've fallen down. A lot of people also need to look into things like legal aid. So that's something to consider because you may be establishing a medical power of attorney. So that's really important as well. And really, I think if you go online and look at those sites, you'll be able to find a whole lot of resources to help you do your job better.
And I guess health insurance too, about a respite care benefit. You said People's Health does do that kind of thing?
Yeah, People's Health actually offers a respite care benefit for patients that have Alzheimer's or other types of dementia. And it's a really nice service because a lot of times those members actually need a lot of care. And so what the respite service allows you to do is, book 4-hour sessions where you can actually go do something as simple as shopping, going to get your groceries, stuff like that you don't think about, but it gives you a little bit of a break to kind of get out, do what you need to do, and then when you come back, you're refreshed and able to help someone else.
And you all are having a free virtual class coming up?
We are, yeah. It's on December 16th, so next month. We actually have a virtual class called Caring for the Caregiver. It's at 10 o'clock on December 16th, and you can sign up for that at peopleshealth.com wellness. It's got a lot of really good tips on it and kind of opportunity to learn a little bit more about what the resources are in the community.
And one of the difficult things here, Doc, is the whole, I guess, flipping of the script as the relationships go, right? The parent becomes a child in a way and the child becomes a parent.
Yeah, and that can become, very frustrating for both the caregiver and the person receiving care. That's why it's so important to kind of establish that relationship and make sure that the person that you're caring for really understands what you're trying to do. And it can be very difficult sometimes, especially in patients that can get confused and may have some issues with dementia. So they may not understand. So the caregiver really has to recognize what their limitations are and really recognize that they're doing everything they can to help that individual.
Doctor, thank you for all the information, really, and I hope you have a great Thanksgiving.
Thanks, Tommy. You too. Stay safe.
You too, sir. You can always visit peopleshealth.com/radio to get some more information. You can call 855-821-2666. And, of course, follow People's Health on Facebook, Twitter, Health on Facebook, Twitter, Health on Facebook, Twitter, Health on Facebook.